So I wanted to talk about omeprazole. You can see it here. Omeprazole's prescribed in the case of severe reflux, or if a baby's really unhappy with their reflux symptoms, if they're not gaining weight as a result, it might be omeprazole's prescribed. The research around using omeprazole, which is actually called a PPI drug, which stands for a proton pump inhibitor. It means it suppresses the production of that stomach acid for that baby in the hope that it keeps them more comfy and what comes back up isn't acidic. So the idea that reflux is kind of acidic, which is often what we associate reflux in for adults, we call it acid reflux. For babies, we suspect that what's coming up isn't always acidic, because actually babies don't produce adult equivalent levels of stomach acid until they're about 5 to 6 months old. So it's really unlikely actually what's in their tummy is going to be at a sort of acidic pH level, because they're having milk on top of milk on top of milk on top of milk, which neutralises it. And the research around using PPIs for refluxy babies says that although it does raise the pH of their stomach contents and potentially reduces reflux episodes, it doesn't reduce a baby's crying or fussy periods, which is worth knowing. Worth noting that one of the many common side effects which are listed in the use of omeprazole is actually vomiting. So it seems questionable to prescribe a medication we're hoping to reduce vomiting when one of the common side effects of giving that to somebody is in fact vomiting. We also know that babies who are prescribed omeprazole have lower absorption levels of certain minerals, including B12, and will have less vitamins in their body as a result of being on the omeprazole, because it changes the way that vitamins and minerals are absorbed. We also know that babies who are prescribed omeprazole have a higher risk of bone fractures and a higher rate of infections, including things like pneumonia and gastrointestinal infections. There have also been some studies that suggested a baby's far more likely to go on to be diagnosed with a food allergy, having been prescribed a PPI like omeprazole, than if they weren't. So as with any medication you might be considering giving your baby, it's really important to have a risks versus benefits conversation with your healthcare professionals. Reflux is a really challenging condition for babies and parents, and while it can be really, really miserable to manage, it's important that we work through all the other steps of making sure that we're minimising reflux symptoms as much as possible and saving this for babies whose reflux is really severe. It's also worth bearing in mind that if your baby's been prescribed omeprazole, when it comes to coming off omeprazole, you want to wean your baby off it slowly. You don't want to just stop it suddenly. If you decide that omeprazole is the right route of treatment for your baby, ideally you want them to be on it a smaller dose for as short a time as possible, because the longer they're on it, the more we know the risks mount up, which is worth bearing in mind too.